right? Are you comfortable with uncertainty? I am. I'm really comfortable with the uncertainty. I'm really comfortable not knowing. If you talked to me 15 years ago as a patient, I would have sounded really smart because I would have told you all about the fascia and what was wrong with your fascia and why nobody else in the world has ever been able to find your problem, because they don't dance around the fascia like I do. Okay. If you talk to me now, I'm going to sound a lot less informed, but I'm probably a lot more well-informed, because I'm going to let you know that, you know what, some people might think it's this or this or this, but ultimately there's a great deal of uncertainty. Number one, what's wrong with you? And number two, what happens when we treat? All right. I still do those hands-on things, except I include the patient in a very different way than I was taught. Not that in MFR we didn't include a patient, but it was all about staying really quiet so the patient could go deep and process their emotional past and present and figure out all the blah, blah, blah. And it's like, you know what? I'm a lot of work. As a patient, I'm a lot of work because I need a lot of input from you to assure that what we're doing is relevant and useful and not just a bunch of stuff that I think is important. So, none of these approaches, I don't think, require you to abandon what you've learned. Maybe just sort of reframe what you learn. Because the things that we do with our hands are helpful. Why is it, though, that we can do so many different things with our hands, and in your case, your feet, are also helpful? Is it really the story that our historical narrative taught us, or is it the common denominators? And that's what we're getting at here, I think.
Yeah, the students, again, it feels like sometimes they want magic. And I go, listen, Carl Sagan, you're made of star stuff. It's already magic. You're alive.
Yeah.
It is 2021.
Yeah.
Like you are the lotto winner in a thing called biology. You're alive. It's already magic. I took SIN lines, which are the basic lines that I teach in my intro Thai workbook. I didn't feel like when I was teaching the work that I don't teach them SIN lines, because I'm like, no, that's part of Thai massage. The sib SIN is a core piece. Let me include the sib SIN and then sort of like help them like reinterpret what's going on with soft tissue here. Reinterpret what's going on with the nervous system. And after your work, even more so, it was like I'd work on the leg and there's a line that goes up the tibia on the inside of the calf, basically around the gastrocs. And you work this line by palm press and finger press. And what happened was, and I wrote this in one of my workbooks, I'm like, what happens when you get tired? Because Walt, I wanted to heal people, Walt. I worked so hard to be like Jesus. I worked so hard to be able to heal people. And if I didn't raise people from the dead and whatever, I was disappointed. And here's what I did. I got tired. And when I got tired, I would lean into that same line and then go like up towards the knee, or, very controversial, down towards the foot. Oh, no. The lines only go up the body. They go up and out the top of the head, sound familiar? And then up and out the hands. But sometimes, based on whatever the clients, they're like, ooh, right there. So sometimes it was like I would grab the line and C-bend it. And then the students are like, well, I don't understand. How do you know? And I'm like, anatomy is a framework. The nervous system is a framework. The SIN lines are a framework. Now, I want you to use a technique and communicate with the client.
Yeah, because it's basically a fourth framework, and probably the one that's most underused and undervalued in our shared professions. When they come to us as the expert, it is so freaking easy to put your cloak of healer on and view yourself as the master. And it really drives me crazy how get myself in trouble with stuff like this. But, lines of training bestow the title of master on someone. And it's like, boy, there's nothing more self-limiting than thinking of yourself as a master. I've taken a lot of education, a lot of training. I continue it. I'm kind of a lifelong learner. But the more I know, the less of which I'm certain. Right?
Yes.
And the one thing that I want to make sure that I include in all of that is basically the undervalued piece that my patient has to offer this. And I tell you what, they're not always willing partners. It takes some work sometimes to get them to actually tell you what they're feeling, telling you what they hope for or fear, telling you things that may at first sound foolish, and they may be a little reluctant to say that. When I ask a question, what are you feeling? Sometimes they'll spend a little moment or two saying, "Oh, how can I make this make sense?" And I'll try to stop them right there. I said, "Don't try. Just tell me what you're feeling." right? Give me the non-filtered version because it's going to be a little bit more, a lot more accurate than you trying to frame it from the framework of a medical practitioner, whoever we are. I want to have that open communication that any good relationship has, whether it's a personal communication or professional relation, or I'm sorry, personal relationship or professional relationship, which is really hard because some patients, they don't expect it. They're not, or they're not willing to go that far. Or, then there's the other person who nods their head that they're going to tell you, for instance, if something is too much, if it's too much pressure. But yet there's something from their past, and I'm not playing Sigmund Freud here, but there's something from their past that keeps them from being able to feel safe or able to say no to you. And if you simply rely on your patient doing what you told them to do, which is to say, tell me if this is too much, there's a small percentage of people who will never open their mouth because it's not safe, for instance, to tell a man no. And I've encountered those patients on my table, and it takes a lot of work to stay in the moment with that person so you can really tell, is this helpful? Is this hurtful? Do you feel safe? Do you feel like you want me to do something differently if they're physically and emotionally not able to tell me that? Tough work, but pretty damn good work,